ABMU Health Board has established a commissioning programme, C4B Commissioning for Quality. C4B Commissioning for Quality is a new approach to how ABMU plans services in order to meet the needs of our population, to deliver the outcomes that matter, and with the resources we have available. We all know the challenges the NHS faces. We're living longer, there's an obligation for patients to have quality of life, there's a huge rise in demand for care, there are ever-increasing financial pressures. Through commissioning, we need to ensure that for every £1 we spend, we get the best for our patients. ABMU Health Board is committed to ensuring that our patients receive the right care in the right place at the right time. As commissioners, we need to understand how we spend our resources and constantly question whether our patients are receiving the right care, where they want to receive it, and at the most appropriate time. This means that we may have to challenge the way we do it now. We need to ensure that we're looking across primary, community, secondary care and tertiary services so that we consider which models of care would best meet the needs of our population, deliver the outcomes that matter within the resources we have available to us. But in order to ensure that we plan and deliver our services appropriately, we need to understand the health needs of our population and what matters to them, and whether we are currently meeting this need or not. This requires some intelligence. So, what is commissioning intelligence? If commissioning is about planning services better, then commissioning intelligence is how we use information from multiple sources of data to assist with our planning. It's about measuring outcomes and pathways to understand inappropriate variance and having the best value for the resources we have available. Data on its own is raw, unorganised and meaningless. It's only when we start to process and organise this data that it starts to become information. This is when we interpret the data and give it meaning. Commissioning intelligence is about developing data into insights. As an example, if we want to help patients live longer, healthier lives, then we need to understand what the needs of those patients are. For example, are they affected by disease and could this be prevented? We want to understand their whole journey through the system, right from their early symptoms through to diagnosis and treatment. We also need to understand what is important to the patient. The information to inform this journey can be extensive, such as GP records, hospital-based systems, evidence of what works well elsewhere, and most importantly, what the patient's experience is of the care they receive. We might also want to understand where these patients live and how they access healthcare and services. We need to ask ourselves, have we been able to deliver the services and outcomes that matter to them? Bringing this information together needs to be a collaborative process. Commissioning intelligence is about moving beyond the silos to get all of this information in one place and make it meaningful. C4B Commissioning for Quality is about understanding the outcomes, both patient-reported and clinical, to be a value-based healthcare organisation. Our aim is to have access to the right data so that it helps us to understand and meet the needs of our population, deliver outcomes that matter to patients and clinicians, and spend our resources as efficiently as possible to deliver the best care we can for our communities.